Morning. Thank you all for joining us this morning. I'm Maya McGinnis. I am working with the Campaign to Fix the Debt, and I'm the president of the Committee for a Responsible Federal Budget. And I'm really excited to join a phenomenal panel that we have with us today to help the Campaign Fix the Debt, which is a large, nonpartisan coalition that is focused on helping members of Congress come together to put in place a comprehensive debt deal. So I'm very delighted that today what we have is a diverse and very experienced group of panelists to talk about two major topics: tax reform and healthcare reform, all in the context of how are we going to work together to put in place a plan that would be able to tackle the nation's fiscal challenges. We will hear numerous different opinions. We will hear plenty of disagreement, and I hope we'll hear a lot of ideas about how to generate different useful reforms to the budget that can help get a big deal put in place. And none of us should forget that what's going on in the political system is incredibly challenging, and members of both parties are working very hard to come up with a compromise deal that will be able to address these challenges and that will reflect sort of the priorities of both parties. So we want to make sure different opinions are reflected here, and we also want to make sure that the whole discussion is focused on how we can work together to come up with a compromise, which is really at the core of what the Campaign to Fix the Debt is focused on. So we are really lucky today to have the kickoff speaker be Senator Rob Portman, senator from Ohio, a very experienced budget expert in both budget policy and tax policy. He sits on the Senate Budget Committee, and he's also been the head of the Office of Management and Budget. So I'm going to turn the microphone over to Senator Portman.
Maya, thank you very much.
And I just want you to know that what you and your cronies are trying to do to us on Social Security is immoral. We do not want our Social Security privatized. We want you to strengthen it, not cut it.
Thank you very much. And thank you, Maya, for inviting me. And it's great to be here with a lot of distinguished budgeteers behind me, healthcare experts and tax reform experts. Excellent. It's all right. They're constituents. I mean, that's great. Thank you all for being here. Maya, I have to talk about her for a second. I've been working with Maya for many years. You know what? Let me finish my comments, and then why don't we do this? If you all want to meet afterwards, I'm happy to meet with you. Shall we do that? Because I want to be sure that I've only got 5 to 8 minutes, I'm told, and right after my talk. Okay? Are you available?
Yes.
Good. All right. Let's meet right back there so that we aren't taking the time away from all these folks behind me who are true experts we need to hear from on tax reform and healthcare reform. But thank you, Maya, for inviting me here and for being the Paul Revere out there for years on deficit reduction. Thank you. Anybody else before we get started?
My name is Tim Foster. I'm a small business owner from Washington State, and this campaign does not have our best interests at heart. We need to fix the economy before the debt, and because I need customers. I don't need corporate crooks trying to steal my Medicare money.
Okay. All right. I look forward to visiting afterwards for all of our Ohio constituents who are here. Where was I? So, thank you. But I do appreciate the opportunity to talk for a moment about tax reform.
I'm a high school student, and I'd like to make it clear that senior citizens are not the only ones who benefit from Social Security, Medicaid, and Medicare, and we cannot cut the program.
Yeah. As you can see, there's a lot of strong opinions on how we deal with our record deficits and debts. But I think everybody here, and certainly the folks I talked to back home, agree we have to. And these decisions won't be easy. As Maya said, the political process is such that it's controversial, and we're going to hear plenty of opinions, it sounds like, from our panelists today, just as we have from the audience. We're Gene, welcome. Would you like to speak? Gene Sperling is now here. Gene and I talked last night. There was a holiday party last night at the White House. At one point, I found myself between John Boehner and Tim Geithner. I quickly backed up. But it was an opportunity to talk to a lot of my colleagues in the House side and the Senate side, Gene and others. I told Gene what I was going to say today, and then I realized after the fact that I have no idea what he's going to say today. So he did a good job finding out what I'm going to say. But I look forward to hearing his comments as well.
Excuse me, sir. I'm Mariah. I came all the way from the other Washington to let you all know my great-grandfather died fighting for Social Security, and I'm not about to let the 2% take away these hard-won benefits from my generation. I'm here for my mom, who's a public school teacher, who spent the better part of 40 years educating our children. She deserves and needs to retire next year. She's 64. I'm here for Darlene, a Spokane native who receives her life-saving blood pressure medication through Medicare Part D. I'm here for Alex, an African-American grandmother of 10 who receives treatment for her diabetes through Medicaid. You know, this woman worked her whole life in the hotel industry. You know, I'm here for my friend Mark, who owns a small business. He's a construction neighbor. And he, you know, his knees are giving out. And I'm happy to leave, you know, and there's more than just the 5 people I mentioned that I know personally. This touches all of us.
Okay, I'm going to take a moment to try to talk, and we'll see if it works. I don't know if other people are here. But I actually think that what we just saw is a true reflection of how hard what we're trying to do is. I'm really disappointed that when we're trying to create a forum to have discussions, we can't have everybody stay, like they were invited to come and actually have this real discussion, because there are real issues that everybody knows about how we're going to try to fix these problems on revenues, on Social Security, on Medicare, on spending, on defense. And there are going to be different opinions about how we do it. And the truth is, there are going to be really hard choices, and people are not going to be able to all have everything they want as we work as a country to try to dig ourselves out of a fiscal hole. So I'm actually not at all surprised that people are concerned and worried about the choices as we're just trying to figure them out. But I am disappointed that when people are coming in good faith to try to have a real policy discussion about how to do it, that we're not able to. So that, I think, is going to be the kinds of challenges we have as we try to do what the campaign is doing, which is create a big table where we can have that discussion. So I think Senator Portman was incredibly generous to say he looks forward to meeting with his constituents, and I would now like to invite him, if you're willing to, Senator, to come up and talk about some of the policies you wanted to talk about.
Actually, they just gave my speech. I'd like to grow, not slow the economy. I mean, that is part of the answer to this. We may disagree on how we do it, but we're not going to be able to get the fiscal house in order without having additional revenue, and that comes from growth. We also need to restrain spending. We need to do both, because in Washington, there is such a deep fiscal hole now that we can't climb out of it without both. So, again, we're going to have differences of opinion as to how to do it. As we saw here today, there are strong views on both sides and all sides, but that's why we need this discussion today and why we need to have a successful outcome, not just to these fiscal cliff talks, but also to this longer-term issue of debt and deficit and economic growth. I was asked today to focus a little bit on what might be possible in terms of tax reform. I know tax reform and health care reform are the two topics we're discussing this morning. And again, I look forward to hearing from Jean and also this distinguished panel behind us. With regard to the tax and health care reform issues, make the simple point, which is that if we go through this fiscal cliff discussion and do not take advantage of that opportunity to put in place reforms to the entitlement programs, which are incredibly important but also unsustainable, and if we do not take advantage of it to look at our tax system, which is antiquated, outdated, inefficient, we will have squandered the opportunity to really address the longer-term problem. We'll be right back on the cliff again. So the first fiscal cliff is approaching. We have to address it. If we do not, we'll see about $500 billion in tax increases. We'll see huge across-the-board arbitrary cuts, including about $55 billion in defense, which the Congressional Budget Office, the Federal Reserve, and others have looked at when they look at the entirety of the fiscal cliff, and they have determined that this could drive the economy into negative territory, meaning back into a recession. That's the last thing we want to see. Along the lines of growth, we need to be sure that we're not doing something here short-term that puts the economy back in a position where we're not generating the kind of revenue because of the lack of growth to be able to deal with these issues and to be able to get our unemployment numbers down. And in my view, this recovery is not your father's recovery. It's different in kind. It's different than any recovery we've had in this country. If you look at even the recovery in 2001 to 2003, that time period, recall we called it then the jobless recovery. And yet, by this time in that recovery, we had already brought back 2.6 million jobs. So at this point, after the recession began, 2.6 million jobs had returned. And that was considered jobless. If you look back at the recovery after the 1980 and 81 recession, which was a recession that was also deep, in fact, unemployment was higher than it was in the most recent recession, we were up 7.2 million jobs at this point. And unfortunately, today we find ourselves still about 4.2 million jobs short. So it's different. It's different in kind. And I think unless we focus on the growth side of the equation, in addition to restraining spending, we're not going to see the kind of robust recovery we all hope for. With that comes additional revenue, of course, and the ability for us to deal with this deep fiscal hole. So I think that it's not a textbook cyclical downturn in recovery, in part because America's fundamental economic structures are not keeping up. And I was asked to talk about taxes today. That's certainly one where America has, in essence, sat on the sidelines and allowed the rest of the global economy, particularly other developed countries, to catch up and in some cases surpass us in terms of the kind of structures they've put in place for their economies to make them more competitive. I give you the great example, of course, of our corporate tax code. Bob Packwood and I were just talking about tax reform. He's got a little background in this from 1986. But really, you think about it, we have these excessively high marginal rates. We have an antiquated system in terms of the international treatment of taxation. And it's because, really, since 1986, America has sat on the sidelines. So while we have, since 1986, done nothing to reform our tax code, every single one of our OECD partners, all the other developed countries in the world have. All of them have. And they haven't just reduced their rates, which is something that is sort of the marquee that people look at. And Canada, yes, has just gone on its federal rate from 16.5% to 15%, and we're at 35%, as you know. But they've also reformed their structure in more fundamental ways, particularly in terms of the international treatment of taxation, in ways that makes them more competitive. And that has led, in my view, to a movement of capital and people and investment and headquarters. And it will continue to unless we deal with it. So it's an opportunity during the fiscal cliff discussions not just to say, how do we get more revenue, but how do we do it through a system that will actually help to create economic growth, rather than adding an additional layer on top of our outdated, antiquated, inefficient tax system. We have the opportunity here to actually provide the necessary incentive to get the tax code to a point where it does create growth as compared to our global competitors, and where we are able to see, therefore, an improvement in our fiscal condition. And so when people talk about What's going to happen here in the short term, the next few weeks? No, we're not going to enact tax reform, and nor should we. It's way too complicated. But there's been a lot of good work done. It's been done by the Finance Committee, the Ways and Means Committee. It's been done by Simpson Bowles and some of the folks behind me. It's been done by Alice Rivlin and Pete Domenici, among others who are here. And frankly, we have a pretty good sense of where we ought to go. I think there's a building consensus about broadening the base. And I think if we do that and do it in a smart way, we could now make a commitment to the additional revenue that would come from tax reform and have a lot more possibility of a bipartisan outcome. Because as you know, Republicans, including myself, have said more revenue on the table needs to come from a couple of things. One is reductions in spending, and that's, again, the important but unsustainable entitlement programs. But second, pro-growth tax reform. And on the super committee where I served, which turned out to be not too super, we talked a lot about that. And we actually had a lot of bipartisan agreement on that fact. As we got down to the details, it became harder. And there are reasons it wasn't successful in that context that I think have nothing to do with the issue of tax reform. But I do think that out of that process, we've developed an understanding among some of us in the Senate and the House as to how we could get there. And certainly the two committees, the Ways and Means Committee and the Finance Committee, are devoted to this, Max Baucus and Dave Camp. When you hear them talk about tax reform, you'll hear some very similar things. So I would hope that in this process we don't squander this opportunity to deal with the important issue of actually reforming unsustainable, important, but drivers of our long-term debt, which is the entitlement side, but also be sure that we do deal with the critical issue of being sure that we have pro-growth tax reform as part of the package. And again, I believe there's enough consensus now and enough common ground for us to put this together in the short term. My own view is we could do it in 6 months, which may seem like an awfully long time to most Americans who look at Washington and wonder why we can't get things done more quickly. But as we've seen here this morning earlier, and as we will see as these hearings unfold in a more serious way, there will be a lot of disagreement, particularly about broadening the base, how you do it. But on the other hand, a lot of great work has been done. 1986 model, by the way, I think is instructive in a lot of ways, one of which is to ensure that Congress and the administration can work together by not drawing lines in the sand. And Gene and I may disagree on some of the specifics, but I think you'll find that we can agree on a lot of the principles, and that's where you start the discussion. And I do believe that this administration, having spoken about tax reform a number of times, the President himself at his State of the Union has talked about it, along the lines of what I talked about today, could work with Republicans and Democrats alike in Congress to get that done. So again, I appreciate what folks have done already in the panel behind me. Many of them have, at some risk, put out their ideas on where we ought to go. I'd planned to take a little more time this morning, but given that the time is cut into a little bit, I'm going to, at this point, take it back to Maya and look forward to hearing from Gene, and then look forward to hearing from some of my constituents on some of the tough issues that we will face as we move forward on this incredibly important short-term project of keeping from going over the cliff, which we must avoid, but also in the process of doing that, establishing the framework for the two things that I think have to be part of it, entitlement reform and tax reform. Thank you all.
Thank you so much, Senator. Next, we're going to hear from Gene Sperling, who's the head of the National Economic Council at the White House, obviously in the midst of a lot of the discussions that are going on right now, and we'll talk about taxes, health, or the big, broad budget situation in which we are. Gene, thank you so much for joining us.
Well, thank you, Maya, for your long-term leadership on the issue of reaching bipartisan fiscal discipline. We certainly have just seen that there is no shortage of passion on this issue. And it is a reminder that for all of the metrics we will discuss today that go into this or that as a percentage of GDP, the ultimate metric, the ultimate end, the ultimate test for everything we do in economic policy is whether it meets the fundamental values that make this country great, which are we a nation in which the accident of your birth does not overly determine the outcome of your life, where everyone has an opportunity to rise? 2, are we a nation where the economic growth strengthens the middle class and creates more room for the poor and others who want to work their way up? And 3, are we creating an economy where those who work hard and take responsibility can raise their children with dignity, work with dignity, retire with dignity? That's the ultimate test. That's the ultimate metric of all we do. Now, I believe there is no reason we should not be able to find common ground for a balanced, fair, and pro-jobs and pro-growth budget agreement. No one on any side should ever aspire to go over the cliff or in any other way to do harm to our economy as a budget tactic or a political strategy. Those of us in positions of responsibility have an obligation to work together to find common ground, or at least painful but acceptable compromise that moves our nation forward. If we can pass the type of balanced agreement the President has advocated, we can beat the low expectations that exist for us and provide a spark of confidence to growth, investment, and jobs. That type of agreement means balance between high-income revenues and mandatory spending, balance in terms of protecting the poor and the vulnerable, strengthening the middle class, and asking the most from those who can contribute the most, and balance in terms of finding the fiscal sweet spot where we both create long-term confidence from showing we are bringing down and stabilizing our debt as a percentage of our economy, but also by including measures like infrastructure and emergency unemployment insurance to ensure we are giving the economy and our families the strength and momentum they need in the immediate term. All of those are an important component of balance, and I'm happy that so many of the fiscal commissions and even I heard the reference from Senator Portman understand that a strong agreement has to make sure that we strengthen the recovery, not overly contract the recovery in the short term. We don't need to do that. We can design an intelligent long-term deficit reduction package that gives momentum and strength to jobs in the immediate term as we create more confidence that we will get our debt and deficits under control in the long term. Now, make no mistake about it, no budget agreement, however robust, will provide the economic certainty and confidence we aspire to if job creators, investors, and working families believe that after we reach that agreement, just months down the road, we will start the next round of debt limit debacles. As both economists and business leaders have told us, only the greatest national tragedies have competed with the debt limit debacle of 2011 in terms of damaging consumer confidence. So let's be clear. If we want to see the economic benefit of a bipartisan budget agreement, we need to agree that the era of threatening the default of the United States as a budget tactic is over. The full faith and credit of the United States of America is something we should cherish and never use as a bargaining tool by any side. This should be beyond question at this moment. Second point I want to make is that contrary to the claims of some, President Obama has put forward specific and detailed mandatory savings on the table and is deeply committed to leading on passing a balanced plan that includes tough but smart entitlement reform. Those of you, and there are many of you who are budget experts, will back me up on the following. It is only the President's budget, not the House Republican budget, that has specific, detailed, and scorable savings in the first 10 years on Medicare. Those measures include not only provider savings designed to increase value for health services, but increases on high-income premiums in Medicare and increases and Medigap reform for new beneficiaries that is designed to discourage excess utilization. And I could go on and on. The President has specific proposals on indirect payment for farmers, federal workforce retirement savings, among many others. We understand that others, including people in these panels, will have other ideas. But so far, we are still waiting to hear a clear and detailed definition of how those who disagree with us would propose to do things differently. Third, it is important that all those who care about our country reaching a balanced and robust deficit reduction agreement understand that it cannot come together without rates going up on income over $250,000. As my colleague Jason Furman and I recently wrote, while the headline number that can technically be reached through simply limiting deduction on high-income earners might seem in the ballpark, such estimates quickly fall apart with the most minimal scrutiny. To take one proposal, the one to limit deductions to $25,000, it is often described as raising over $1 trillion. Yet that estimate relies on tax increases on 17 million taxpayers making under $250,000. If you remove the tax on those middle-class families and have a proper phase-in, which we would all agree you should, the savings number comes down to, at most, $700 billion. But even at this point, there is a fundamental flaw, because the $25,000 deduction cap means that the charitable deduction for all high-income people will essentially be eliminated. It is hard to design a better way to unite the most well-off Americans and those representing the poorest Americans, nonprofit churches, universities, and hospitals against a single idea than proposing to completely eliminate the charitable deduction. You then decide if you make an exception for charitable deductions, your savings go down to anywhere from $350 billion to $450 billion. What does that mean? That means if the president were to take the position that rates could not go up, and he then found that so-called high-income deduction savings max out at around $400 billion, then to get a robust and balanced deficit agreement, the president would have to be willing to agree to over $1 trillion in revenues through taxes that fall mostly on the middle class, something he definitively will not do. Even worse, such a plan would be asking these middle-class Americans to face higher taxes simply to afford lower taxes on the most well-off. That is why the president has made clear he cannot sign and will not sign any bill that does not raise the rates, or one that seeks to extend the Bush high-income tax cuts at their current levels. Of course, tax reform on high-income deductions should be part of the package. The president himself has, in his budget proposal for more than 1 year, a 28% deduction cap on tax expenditure for high-income Americans. So the president has not only shown willingness to support that type of reform on tax expenditure reductions, he has led on the issue and put forward as specific and detailed of a proposal to raise over $500 billion as any as I've seen. And that is why the letter that came to the president from the House Republican leadership yesterday was so disappointing. It not only failed to recognize the necessity of raising rates, it actually called for lowering rates for the highest earners, which inevitably means a worse deal for the middle class. This is very unfortunate because recognition that we must raise rates on the highest income Americans stands today as the critical key to unlocking the door to a bipartisan budget agreement. The letter also was disappointing because it failed to acknowledge what virtually every business leader today recognizes, that we must, for the sake of economic confidence and certainty, end the self-inflicted economic wound of sporadic debt fights that threaten default and tarnish the full faith and credit to the United States. Again, there is no reason for us to approach, no less go over the cliff. If our colleagues on the other side of the aisle will work in good faith with us, I am confident that we can reach a balanced, fair, pro-growth and pro-job agreement in the spirit of good faith and compromise. Thank you, and I'm sure everyone is looking forward to the discussion from the very impressive group of experts, Maya, that you have gathered today. So thank you.
Thank you very much. We're now going to turn to the panel, which is going to be moderated by Peter Cook, the Washington correspondent for Bloomberg, and we'll have a chance for introductions for everybody who's joining us today, and then plenty of time for discussion.
Thanks very much, Maya. Thank you all for being here, and happy to be here to moderate such an impressive group. We have a lot to get through over the course of the next hour and a half. We have a lot of people here at the table. I'd like to pull out each and every one of your perspectives through the course of the next hour and a half or so, and if you don't chime in, you can be sure I will pick on you, bring you into the conversation. It's my goal to be a facilitator here to let you all exchange your ideas. You have insights and perspectives that are unique, and we'd like to all hear from you, and again, hear some of the ideas on the table. Maybe Gene and Senator Portman will leave here with a few ideas or get some ideas from this group. So again, we look forward to that. As Maya said, I work at Bloomberg Television. I've been covering these issues for about most of my career at Bloomberg Television. It seems like this is a huge issue for our audience, huge issue for financial markets, not only here in the United States, but around the world. This is important for us. And this programming note that I'm going to end this thing on time at 12:30 today because the President is granting Bloomberg an exclusive interview today that will air at 12:30 to talk about these issues. If you miss it, you can catch it in our special at 8 o'clock tonight. But an important time for our coverage as well. Let me go around the table first of all and give a quick introduction to everyone. Most of you are recognizable. I've interviewed most of you all at various times, have bothered you, chased you down hallways in Congress and other places. But first of all, Senator Pete Domenici. On the end, longtime senator from New Mexico, served as chairman of the Budget Committee, the Energy Committee as well, and has offered ideas as part of the Bipartisan Policy Center on these topics. And we have Cindy Gillespie, who is an attorney here in town with McKenna, Long, and Aldridge, and more importantly for this conversation, has unique perspective as an advisor to Mitt Romney when he was governor of Massachusetts and he implemented health care reform in Massachusetts. We have a business perspective from Paul Stebbins. He's executive chairman of the World Fuel Services Corporation, offering again a sense from the business community what these solutions might be and how business will be affected by everything. We have Governor Phil Bredesen, who served as governor of Tennessee, also as mayor of Nashville, bringing us a perspective, a state perspective and a local perspective on many of these issues, dealt with health care issues in Tennessee. Senator Judd Gregg served New Hampshire as both senator and governor, served on the Budget Committee, served on the Simpson-Bowles Commission, knows these issues. I've bothered Senator Gregg many times on Capitol Hill about these topics, and I've bothered Alice Rivlin more times than she cares to probably say on Bloomberg Television, talking about these issues, her unique perspective as head of OMB, head of the Congressional Budget Office, vice chairman of the Federal Reserve, so many different hats, so much perspective right there from Alice Rivlin. David Cody, who served on the Simpson-Bowles Commission as well, another business perspective, the CEO and chairman of Honeywell. I see him in Washington more often than I do some members of Congress. I won't get into that too much with you, David. Maya McGinnis, of course, you all know. Neera Tanden, who served in the Obama administration and the Clinton administration, the president of the Center for American Progress. They've offered a host of ideas on these topics as well. John Rother as well. He's the National Coalition on Healthcare president and CEO, also served for many years at AARP. Mark Zandi of Moody's Analytics, also a regular on Bloomberg, someone we count on for perspective on the economy, noted economist. Congressman Vic Fazio of California, served for many years in Congress, part of the Democratic leadership on budget and appropriations issues. Look forward to hearing your perspective. We have Ed Heiselmeyer as well of the Heritage Foundation, expert on these issues, helped with some of the reforms in the state of Utah, as I understand it. And Michael Peterson, he's the president of the Peter G. Peterson Foundation, which of course has devoted so much time, energy, and attention to these issues. So thank you all for being here. Again, look forward to all of your perspectives. And I'm going to start, as I'm told you, I have counted on her often, Alice Rivlin, to set the table here on these particular issues when it comes to health care, federal health care spending. If we all agree, and maybe not everyone does, that federal health care spending right now is unsustainable, it's putting the nation on an unsustainable fiscal path, if you can, walk us through the big picture challenge and some of the ideas that you at the Bipartisan Policy Center have put forward on how to deal with it.
Thank you, Peter. I think that fixing the debt is the key to growing the economy, and that reducing the rate of growth of healthcare spending is the key to fixing the debt. Now, we also have to raise more revenues and in a fairer and simpler way, and we'll get back to that. But there are two big opportunities now with this big problem. One is to improve our tax code, but the other is to improve our healthcare system so that it delivers more and better healthcare than it is delivering now, but at a cost that is not rising so fast. The thing that is driving federal spending, as you look ahead on anybody's projections, is the rising cost of Medicare and Medicaid and other health programs. That's because of the demographics of the rising age of the population and the baby boom generation retiring, and the fact that our relatively inefficient health system is generating costs which rise every year faster than the costs of other things. And that isn't anybody's fault. It isn't Republicans or Democrats. It is simply the facts of what is happening as you look ahead. And if we don't slow the rate of growth of health care, it shows up in the federal budget, in Medicare and Medicaid, it shows up in state budgets, it shows up in every budget. But I don't think the parties are very far apart on what to do. The campaign was interesting because if you listen carefully to what the candidates were saying about health care and Medicare in particular, what they were mostly saying was, if you elect the other guy, he's going to cut your Medicare. Actually, nobody's going to cut your Medicare if you're on Medicare now. And the people who were trying to get attention earlier, I think simply don't understand that what is at issue is slowing the growth of costs of care over the next couple of decades, not cutting services to anybody who is on Medicare now. And the opportunities are enormous. The villain, if there is one, by common consent, I think, is our fee-for-service healthcare system. We reward in our payment structure the delivery of more services. And if you're being rewarded for delivering more services, what do? You deliver more services. And there isn't any reward for delivering better services, for coordinating care across specialties, or for taking the best care at the lowest cost of individual patients. So the reformers have coalesced around, let's use Medicare and Medicaid to move the reimbursement system to something more sensible, to rewarding quality of care and rewarding providers for keeping patients healthier. Now, there are a couple of ways you can do that. Democrats tend to favor doing it by experimenting with different things and then moving by regulation. Republicans tend to favor competition, but it isn't a hard and fast line. Neera's here, and her organization has just produced a report, which I thought was terrific, about how to use competition to reduce costs in Medicare. And she can talk more about that. But I don't think there's such a big divide here. The divide is much more apparent than real.
Well, let me pick up on that point with Senator Gregg. You've got some of the bruises to show for the battles between Democrats and Republicans over these issues. Is the divide really not that wide here? Walk us through the reality right here when it comes particularly to the healthcare issues and trying to restrain these costs.
Well, I think the divide isn't that wide. And I think that there's a consensus building as to how you address health care, and Alice has outlined it. And right now, it's the language and the scoring that's the problem. But if you look at a group, there's a group called the High Value Healthcare Collaborative. and it's 20 major hospital groups across this country who insure about 70 million people, serve about 70 million people. It's a number of top hospitals like Baylor, and Dartmouth, and Seattle, and UCLA, and they've come to the conclusion that 30% of healthcare is waste in the delivery system. And they've taken 9 of the major treatments that they consider to be inefficient and done a very in-depth long-term statistical analysis of how those treatments should be given. And they've shown that even within those high-end healthcare delivery systems, which are working as a collaborative, that, for example, on a total knee replacement, there's a difference of between $2,000 and $20,000 as to what it costs to do the total knee replacement. But the outcomes are the same. The quality of outcome is the same. And so by using statistics and using best practices, they believe they can radically reduce the cost of healthcare while still increasing the quality of healthcare. For example, in total knee replacements, they expect that you could save close to $1 billion a year. And the issue for Washington is that Washington has trouble with things that work. It has to always go back to nomenclature of reducing providers, increasing the cost to recipients, rather than allowing experimentation, which occurred in the states like the governor of Tennessee did in Tennessee, to basically become the drivers of better policy. And how we shift the paradigm here in Washington so we actually reward and use, and we don't have CBO retarding the ability to reward creative ideas like the high-value healthcare collaborative is really, I think, the essence of how you get an agreement. I don't think there would be any disagreement on either side of the aisle. In fact, there wasn't. Moving to an outcomes value system from a utilization system is what we want to do. The question is, how do you do it structurally in a system which is straitjacketed by CBO rules and by old-time philosophy of ratcheting down providers? And that's where I think the transition has to occur.
Neera, your name was mentioned before. Let me get your perspective on this and some of the ideas on the table that the center's put forward for trying to deal with this.
Right, and I welcome the focus on national health expenditures because I do think that should be the goal of what we're doing now and in the long term. It is a challenge for our long-term competitiveness as a country. The fact that employers face such high costs through healthcare costs for their employers is a challenge when you're trying to hire. So the Center for American Progress has focused on national health expenditures because we feel that is the right solution. And as the Affordable Care Act there were proposals in the Affordable Care Act to address national health expenditures and reducing them, and we have ideas like competitive bidding in the Medicare program to ensure that there is a process by which Medicare works to get the lowest price for goods and services. Because there is inflation in that process, and that can save $40 billion, and that's something that we should have agreement on a bipartisan basis. We also have ideas around using state mechanisms. We call it accountable care states, where you really work at the state level to reduce costs amongst providers. So using the Medicaid program, working with private insurance, to leverage that power together to reduce costs in a way that produces efficiency. I agree, we don't want to just have cuts here and there. We want to have a system by which there's leverage points to actually reduce costs in a way that's most efficient for employers, et cetera. But I think one thing I do want to focus on is that we are in an interesting moment in healthcare, which is we've been through a long-term period where healthcare costs have grown much higher than inflation. That is why we have these long-term projections of increased costs, Medicare taking up more and more. Alice is exactly right. The long-term projections on Medicare eating up more and more of the federal budget are because we have more seniors, which should not have been a surprise to anyone. We always knew those seniors were coming, and medical inflation. And over the last 3 years, we've actually had good news, which is a reduction in medical inflation. We are now, last year it was 1 point lower, and before that, we've averaged lower increases. Now, part of that could be because of the recession, but I also think that a part of that is because the healthcare system is transforming itself. The Affordable Care Act has provided changes in mechanisms for delivery, bundling, accountable care organizations, and I think the providers and others see change happening. So the one thing I caution for the deficit talks is that I think we should all support mechanisms to reduce national health expenditures, because that is important for all of us and our long-term competitiveness. But as we look at issues which simply shift costs from the federal government to seniors, or from the federal government to employers and other programs, Medicaid programs, et cetera, I think that is something we should really question. And I think whether we lock in long-term changes in this moment of flux is something that I think serious policymakers can have a real discussion about.
Let's have a discussion right now. Senator Domenici, do you take issue with any of that?
Well, I don't know if I take issue with that. I wanted to say I think I'm going to have to be gone soon, and I wanted to have an opportunity to say a couple of things. First of all, if you all are as tired as I am, we would probably say that you all went to the ball game last night. The Redskins won
RG3.
by one. And I don't know what time it was over, but that was about as exciting a time for this city as they've ever had. And it came to my mind when you mentioned Baylor, somebody did, that young man, Griffin 3, is from Baylor. And he was also very high in the academics there. And you can tell it last night after the ball game. He talked for about 30 minutes. He didn't go to the dressing room like most people. He just sat there and talked and answered questions. It was rather impressive. I wanted to say a couple of things following on my partner. As you all know, the Bipartisan Policy Center has submitted a budget. In it, we have the framework that we think we need for entitlements, which includes the biggest entitlement, Medicare, and both Dr. Rivlin and I serve on that. She serves on a lot of other things, and we both take great pride in telling everybody that we are really in tune with the problems of the seniors, because each of us exceed 80 years of age. And so we should know, and that then brings a howl from those that are younger saying, why are these oldies going to be telling us what to do? But what I want to say to all of you is that we are already past the point of debating the issue of how are we going to, in the long term, reduce the debt of the nation, annual deficit, sufficiently so that our debt is not rising as it is, which is in excess, the deficit is in excess of $1 trillion each year. You must do something that brings that down, or you are destined to have many programs that won't work, including Medicare, which certainly will go by the way of some serious financial problems soon. So when you look at it, all the major programs, the line expressing their future is rather parallel to the ground. All of them are controllable, including Social Security, very controllable, except one line which we always put in blue. And the blue line is healthcare, and it just goes up, and away. And it cries out for a long-term fix, not a next week fix or a next year fix. And we can't be telling our seniors that the current crop is going to have any serious effect on them, or even 10 years from now, there won't. But over the long run, that curve must get bent, or America is destined to go down the way of countries that had fiscal policies that debauched their currency. So it is, whatever you talk about, if you are not willing to say, how do we get this cost line of Medicare bent? And to me, it is very difficult, because we must do that over a long number of years, and it's very hard to do it in 5, to get very big savings in 5, even 7, even 8. You start getting some in 9, and you get some in 10, and then you have a plan in place that you continue out, you will save trillions of dollars and maybe save the government of your country. If you can't put that down on paper and support it, and I would say to Mr. Sperling, he ought to take back to the President that there are some Republicans who have cried out to Republicans, raise the revenues. I was one. They didn't talk to, some of them wouldn't talk to me for a while. They all are talking now. Raise some revenues and put it on the table. Well, that does not mean that with that we get rid of the need for savings in the entitlements. So if you put taxes on the table and don't put a formidable, powerful entitlement program on the table, the Republicans are right in my way of thinking, of saying there is no chance for a deal. We'll do revenues, but you won't do entitlements. So I cry out to put on a big entitlement package, Mr. President, and stand behind it as a multi-year savings. Get your people to do that, and you get a real start. Now, I don't know how the top 2% is going to get solved. That has turned into almost an ideological question, and we'll get to that. Maybe it'll. Thank you very much, Mr.
Well, Senator, you raised some good points, and I'm going to turn to a numbers guy, business guy right here, David Cody, who has been responsible for putting, along with other members of the Simpson-Bowles Commission, a plan on the table. David, what's feasible? What should the grand bargain produce in terms of savings, for example, from Medicare, these health care spending? What's really feasible? What's right for the country?
Well, if you don't mind, I'd like to broaden that question just a bit, Peter, because I'd like to echo some of what some of our other members have said today, because for us as a business community, this has to be put into context if it's going to mean something. And the world's big democracies are in gridlock over debt. It's not just the US, it's the EU, India, Japan. We're all in gridlock over debt. And the world needs leadership right now. And there is the possibility for a robust recovery, not just in the US, but I think the opportunity to stimulate something in the rest of the world if the US would exercise leadership here. Leadership for me means that we need a market-credible $4 trillion deal. And while you can't guarantee that there would be a big economic recovery, because despite the amount of math behind it, economics is not a science, as Alice would probably tell you even before I would. But at the end of the day, it sure increases the probability that that can happen. And during the course of that, we need to make sure we avoid this fiscal cliff, and we shouldn't be having this debt ceiling issue every 9 months. That does not contribute to market stability. So if we're going to have a $4 trillion deal, it means that we need certainty in both the taxes and on the entitlement spending side. Both of those things need to happen. And if we're going to have market credibility, markets have to be able to look at it and say it's for certain. When we do look at the federal health spending, I would like to see both a short-term and long-term approach here. On the short-term side of this, there's only one way to get this thing done, it seems to me, by December 31st and have any kind of market credibility to it. And it's going to have to be kind of hard and fast stuff that people can look at and say, okay, I can calculate it, I can be sure it's there, whether it's things like raising eligibility age, change CPI, means testing, the sort of things that people have already talked about. Those should all be in play, you think? I think all of those should be discussed, because this is not just a this decade issue, this is a second and third decade issue. So all of those things ought to be in play. But then echoing comments that a number of folks have made, there needs to be a long-term approach here also. Just like we were talking about on taxes, where we say, okay, we understand the need for rate. However, you need to do something that's going to create a better system over time, because our system is incomprehensible and ineffective today. We need to be doing the same thing when it comes to health care spending. The amount of inefficiency, the inability to spread best practices, the variability in outcomes is, I just find, incredible and not tolerable in other industries. If we operated as a company with that kind of variability in the work that we do, we wouldn't survive. But because of the system that we've created, as pointed out by several people, we have a system that tolerates it and almost encourages it and supports it. And if we could have something that focused a lot more on the quality of outcomes and paid for that, I think we'd end up with a significantly better system. We've tried to do this in Honeywell ourselves. And I could tell you that even as big a company as we are, it's a tough thing to do on your own. And you need a system that kind of is geared that way already. So I'd like to see both a short-term and long-term approach on entitlements if I'm going to first believe in a market-credible deal and that we're going to fix this thing going forward.
Let's get into the weeds a little bit. Ed Heiselmeyer, I'm going to tap your expertise here. How do you reward quality outcomes versus just the quantity of these outcomes? Any thoughts on that?
Well, I mean, that's been alluded to already, but I think we have to back this up a bit. You know, the first thing I would say is the debt is the symptom, it's not the cause. The cause is a fiscal imbalance, and the fiscal imbalance is pretty straightforward. You know, we're spending far more on a long-term basis than is sustainable with the revenue base we have today. And we've managed this for 60 years because we off and on spent a little more or a little less than the revenues. But now we are on a path of consistent spending, both in terms of the programmatic design and also, as been mentioned, the demographics. So that gets you to the following. We either have to increase the taxes to cover the entitlement spending, or we have to restructure the entitlement spending to fit within our tax revenue. Now, that gets us to 2 points. One, there is no earthly way you're going to get more than 14% of GDP out of the income tax code, no matter what you do to it. We have over 60 years of history of that. We have never, since World War II, exceeded more than, I think the peak was 1 year in the 50s, 13.72% of GDP. So what is going on in this whole debate is a charade about the tax rates. It's a question, and as my economic colleague said, this isn't a negotiation, it's a knife fight. And it's a question of, does one side split the other into agreeing that essentially we're going to keep the welfare state and we're going to fund taxes, because then you have to actually fund it, and then you get the VAT tax and all the rest. Or do we go the other way? And that's where we get to your question, which is, healthcare, we spend more than any other country in the world. That's what's driving the entitlements much more. I mean, Social Security is a demographic issue. Healthcare is both a demographic and a spending issue. Well, it's a question of value. I mean, if we're spending more than anybody else in the world and we're not satisfied with the results, then it strikes me that, you know, we're not getting a good value. So that comes down to, do you get better value? How do you get it? There are 2 ways. You either move to a defined contribution and enable people to have the incentives to produce, you know, you get more business if you provide better value, people choose based on value, and frankly, my metric is how many hospitals are going broke because they provide substandard care. Until I see that, we're not providing value, okay? The other option, and it's embodied in the Patient Protection Affordable Care Act, is we'll get better value through central planning. We will redesign the system. I keep asking people when they pass that bill, what is an ACO? How is that different than Kaiser Permanente? Nobody could give me an answer that showed any real difference. Well, it's not. It's somebody's idea that that's the way they're going to do it, and we're all supposed to dance to that tune and follow along. I don't believe that that's going to achieve the better value. But that's the fundamental fight. What is interesting about that is that's the flip side of what the president's trying to do. The Republicans in the election were able to take the first step, which is to negate the idea that somehow Medicare could not be touched. They didn't get defined contribution, but they've now put it on level ground. So that's where this thing hangs in the balance. We either move healthcare into a defined contribution world, or we have to significantly come up with new tax sources to pay for a defined benefit world.
Governor Bredesen, is that the choice we're facing?
In the short term, I think you've outlined it well. I'm a Democratic governor, and I agree with you in a real sense about that, in that we have, over the years, and I think the Affordable Care Act, I'm certainly a supporter of the president, but not an admirer of the act, sort of lost an opportunity to make some of these changes that are going to be necessary. You know, these changes to health care and the way the system operates they're really difficult. And the stuff which has been talked about so far really is kind of marginal and on the sides. To mangle an analogy that you made a moment ago. It's kind of like bringing a nail clipper to a knife fight, when there are these huge economic forces at work to keep this cost rising. I personally think that the answer is, we've talked a lot about quality. You've talked about, David, what you have done up here. But the situation of being able to measure quality in the healthcare system is really a mess. There are very few agreed upon approaches to it. When you measure the quality of hospitals with different techniques, they're just uncorrelated. Hospitals that do well under one set of things don't do well under another set here. And one of the things we could do seriously for the long-term fix, and this is just get serious as a country about defining what quality in medical care is. That's very difficult, but we have a public interest in Boeing building safe airplanes. We don't let every welder weld their own way according to their personal professional standards, and every riveter rivet their own way, and then count how many airplanes crash as a result of doing that. We know how to do quality assurance systems in this country. You define what you mean by quality. You put things in place to measure it on an ongoing basis. And if you did that, you don't need top-down, you just unleash an enormous amount of creativity out there in the world about how you go about paying for these things, and how you get the kind of value you want in the healthcare system. I just really think this issue of getting serious about talking about and measuring what we really mean by quality in healthcare is the key to making that happen.
John Rother, I want to get you to weigh in on that.
I'd like to make several statements, starting with the fact that the current system in healthcare is an unsustainable burden on families and family budgets. Today, about 25, well, for the older and sicker population in Medicare, the group we really care about, are spending an average of a quarter of their total income on out-of-pocket healthcare expenses today. And that's putting people into the poorhouse, into the Medicaid program, and that's an unsustainable situation. So we do need to change healthcare, not only for the national finances, but for family finances as well. Secondly, there is a consensus that we are wasting about a third of our dollar spend in healthcare across the board. Many groups have studied this. I was part of one at the Institute of Medicine. It's no one segment of healthcare. It's across the board. So if we're going to get serious about better value, everyone's behavior has to change. All stakeholders need to change. And the key is changing incentives, because fee-for-service is the wrong set of incentives. We've got to change incentives so everybody can get on the same page of producing better value, not just greater volume. We've put out a report that specifies quite a few changes that we think would be constructive, that would save money and improve care at the same time, and not shift costs, because shifting costs is a way to make the problem worse, not better, for the whole economy. So I think that we should not ignore the final point I want to make. We should not ignore some of the real drivers of high healthcare costs. And what we have in this country today is an epidemic of chronic conditions, whether it's diabetes or hypertension. And that has to do with behavior. It has to do with our food supply. It has to do with diet. And it has to do with a lack of attention to population health. So we're missing the boat if we just focus on the sick care system and we don't look at the same time at what we need to do to drive down the burden of chronic illness, which is otherwise going to overwhelm us. So there's a lot to do here, and we need a comprehensive approach. I view the coming deficit negotiations as a real opportunity to do things that we've known we need to do, but we haven't had that political opportunity. Now I think we do.
Congressman Fazio, I'm going to put you on the spot because you're not in Congress right now. You know some of the political realities, though, that your colleagues there are facing, particularly on the Democratic side. If they ask your advice, how far should we go in these negotiations when it comes to entitlement reforms, given what the Democrats have campaigned on? What's your advice?
Well, I know it's difficult. When we heard people speaking earlier today, I think everybody understood that people were speaking from the heart. It wasn't just a demonstration for the sake of a kind of a political scream. You know, this was just really the kind of thing the Democrats face when they go back to their districts. But Republicans do as well. This is not an easy area to legislate in, but I think we have to do it. And I totally agree with comments that lead us in the direction of going away from fee-for-service medicine. And one of the things I would suggest we try to do to break out of this kind of system that we're locked in is to look at the doc fix, the SGR fix, that's this huge bow wave of expense that's ahead of us as we try to reach this deficit package in the short run and over the next year. Why not we change the way in which we reimburse physicians? Why don't we incentivize group practice? Why don't we incentivize people who are setting up models that move us away from fee-for-service medicine? I think that would do a lot to break this impasse where we all in general agree but don't know how to get to a new system. But let me hit one other subject, and it really relates to my good friend Pete Domenici. His other committee was appropriations. And so those of us who served on that committee have come to understand that if we don't deal with the long-term costs of health care through Medicare and Medicaid, we don't get a handle on entitlements in general, and we don't raise revenue, we simply continue to cut domestic discretionary spending, which is where most of our budget reductions have been made in recent years. Capping, freezing, CRs that go back to last year's numbers. What are we hitting? Center for Disease Control, the Food and Drug Administration, National Institute of Health, Cancer Institute. These are programs that John was just pointing to as really fundamentally important to our healthcare system going forward. And so if we really want to deal with the public health issues that need to be dealt with, it seems to me it's imperative that we take some measured steps to relieve the pressure on domestic discretionary spending, particularly for health care.
Michael Peterson, your foundation's been actively involved in trying to get public input on these issues. These are tough choices. Americans would feel some pain no matter what, where this comes down. At least that's the appearance right now from both proposals we've heard from both sides. Mm-hmm. What is your sense about the American public's appetite for major changes here when it comes to healthcare spending going forward?
Well, I think it's essential that we get them on board with these changes because healthcare is such a fundamental fiscal challenge and an economic challenge. We would certainly agree that fixing the debt is the key to our economic future and preserving our future prosperity. And as Alice said, healthcare is the unique and key fiscal challenge for the future of the country. First of all, it's the largest by far fiscal challenge. It represents probably 80 to 85%, depending on how you measure, of our long-term obligations, close to $40 trillion. So there's really no future solution to stabilizing the debt that doesn't include healthcare. Secondly, it's very unique. As opposed to Social Security or defense spending or tax reform, those issues can be solved in Washington, although it's difficult and takes time. Those can be solved right here in Washington with legislation. The healthcare system is a public and private system, so there's a lot of things that need to get done at the federal level in terms of policy, but underlying all of this is a delivery system that delivers care to both the private and public parts of the system, and you can't get at this problem unless that delivery system becomes more efficient. The problem there, though, is that it's a very complex set of drivers for these costs. You have an incentive structure that rewards greater volume instead of greater value. You have malpractice issues. You have end-of-life questions about spending such a huge part of Medicare in the last year of life. You have chronic illnesses. You have huge variations, as Senator Gregg said, in the level of cost for certain procedures. And I think what we need to do is design reforms to all these key drivers and work on all of them. And I think it's something we need to do right away at the federal level, but also very importantly at the private level, because this is a huge economic and fiscal challenge, and it's going to take a lot of work and a long time. And I do think we need to get at it immediately, even though I agree with Neera, the cost curve is slightly less steep in the last couple of years. I don't know whether that's economic growth related or improvements, and I think there's reasons to be optimistic that there's a huge amount of value that we can be gained here. And value is an important word. This is not just cutting spending. This is achieving better outcomes at the same and I think quite possibly lower cost. So it's about really the value equation, not just a spending number and a budget.
Before I go to Mark Zandi for the macro picture, I'm gonna go to Cindy Gillespie over here. Your experience in Massachusetts, you've heard some of the ideas put around the table here. You're helping with some of the exchanges being developed around the country. Give us your perspective, what you've heard so far, and what you would do differently.
One of the things that's interesting and what everyone's been saying, we all seem to be talking about the same thing, shifting more to outcomes. And one of the bigger opportunities in my mind that came through this year was when the Supreme Court ruled that the Medicaid expansions could not happen unless the governors and the states chose to do the expansion. It put the governors at the table on any sort of health reform that gets done here around the entitlements. And I think that's extremely important. I'd really love to see, as Washington engages in entitlement for reform this time, the governors at the table talking through how they will fix Medicaid. Because if they don't, if they're told this is the steps to take, this is how you do it, you're talking about a very removed buyer, or really a payer, sending money to someone else who's actually doing everything. And the governors have ideas. And they have different ideas in different states. And I think that's extremely important. Is your answer
block grant to the states?
My answer would be, I personally like the idea of a defined contribution to the states with some sort of outcomes that the states have agreed to. And that's where the discussion can be. When you look at what's going on a macro level, you have, with the Affordable Care Act, you have a variation that says individuals in this country between 0 and 400% of federal poverty level are entitled to some sort of a subsidy, potentially, depending on their employer. Okay. What's interesting is that's given to the states, if they choose to take it, with in buckets. This population has to be in this program. This population has to be in that program. It's given to them in buckets. It's given to them with strings. It's given to them in a lot of ways. But it's not given to them with the flexibility to figure out how to take their population where they want where their population wants to go. Simple example, Massachusetts had an exchange, right? They have an exchange that individuals up to, at this point, 300% of federal poverty level can get a subsidy. One of the things Massachusetts is looking at doing is taking the individuals in that exchange that could instead be put in a behavioral health plan under the Affordable Care Act, taking them all out of the exchange and putting them instead into a behavioral health plan run by their Medicaid department. It would be a Medicaid managed care plan. That exchange will go from about 180,000 to about 60,000 people left in it. So they have the flexibility to go that way, but does the state have a flexibility to go the other way and take some of that population between 100 and 133 or even down below that and do maybe a 3-share with an employer? Louisiana is sitting there with what? The study that came out, about 800,000 of their people that are currently on employer insurance will instead wind up in Medicaid. Why don't they have the flexibility to deal with that? The states have some fascinating things they are doing around behavioral health incidents. You always see a lot of comorbidities when you have behavioral health. The states are doing amazing, amazing work. New York's done some stuff, Washington State, Rhode Island. But that may not work well in South Dakota. So that discussion with the governors, Democrats and Republicans, at the table about how would we work together to fix Medicaid? Because you got to do it with them. I think that's a key to that part of the entitlement, not Washington telling them, here's how we'll fix Medicaid.
Before I open this up for everyone to weigh in, I promised Mark Zandi I was going to come to you for the macro picture. You've heard a lot of numbers flying around here. Give us your numbers on what's at stake here, what's at stake here, and what the solution needs to be in terms of the U.S. economy.
Right. Well, the way I look at it, or at least my perspective on it, is through inflation. Overall, inflation is about 2% per annum, and that's what we've been getting for a decade, 2 decades. That's what the Fed's targeting. That's what we should expect to get. Healthcare inflation is a point or two per annum above that. We've seen some slower growth recently, which is encouraging. But you know, obviously a lot of moving parts, and it could be the tough economy playing a role here, so we'll have to see how that plays out. But if the gap between healthcare inflation and general inflation is a point, point and a half, 2 points, you know, obviously that's the problem. We have to bend that healthcare cost curve. And I think we don't really know how to do that. That's, you know, might sound odd coming from an economist. We don't know how to do that. A lot of great ideas, a lot of different perspectives, but, you know, I don't think this is an engineering problem yet. We don't have all the information that we need. Now, in that context, I'd say three things. First is I think it would be a mistake to make a big change to our healthcare system, because we really don't know. So in my view, that would be block granting Medicaid or voucher premium support for Medicare. I think that those are really big, fundamental structural changes, and I don't think we're there yet. You know, maybe we get there at some point, but I think it's premature to go down that path. The second thing I'd say is we need to experiment to try to get a better sense of, you know, how we can bend that healthcare cost curve. And I actually think the Affordable Care Act has a lot of interesting experiments embedded in it that maybe we'll get some data points and get a better understanding of this. You know, things like, for example, the Independent Payment Advisory Board, much maligned, and, you know, that could go badly wrong, but, you know, I think it's a worthy experiment. The healthcare exchanges, insurance exchanges, I think that's a pretty good idea. I think introduces some competition. Let's see how that works out. I actually think the Cadillac tax has a lot of merit to it. Raise the cost of healthcare for guys like me who have gold-plated healthcare plans, make me go out and shop. I mean, right now, I'm unfettered, and I'm not shopping for healthcare, and therefore, I don't demand information. But if guys like me have to shop for healthcare, I assure you I'll go get information, and the whole system will become a lot more transparent, and I think that has some benefits. So I just named a few things.
2014, when more of the Affordable Care Act kicks in?
Yeah.
You think we're going to see dramatic changes?
No, this is not dramatic, but these are experiments that, again, I think will reap some benefit. And again, we'll get data points and it'll help us understand what to do. And then the third thing I'd say is that despite all this, we do need to make some cost cuts to Medicare and Medicaid now to make this work, to make the arithmetic work. $4 trillion is a heavy lift. Of course, it depends on what your baseline is, of course. And what is in that baseline. But the president's $350 billion proposal is too low. It's got to be bigger than that. It's got to be...
Give us a number, yeah.
Yeah. I think it's got to be 600 to 700 billion in savings. And you can do that by listening to what the Republicans are saying about, you know, we can debate the merits of some of the proposals, but some of these are reasonable. They're certainly worthy of significant debate and should be included in the discussion. And at the end of the day, we may need to adopt them. None of these are good choices. You know, obviously nobody wants to do these things, but I think we have to do them. So 600, 700 billion, 10-year deficit reduction from Medicare and Medicaid. If we can do that, and I think we can with some reasonable ideas, not big structural changes to these programs, but fixes around the edges. Not that there won't be pain, there will be. I think that would fit in the context of some of the revenue estimates, and we got a deal that would stabilize the nation's debt load by the end of the decade, and I think that should be our goal. If we can hit that goal, I think we're good, and we'll be off and running.
I know there are folks who want to weigh in. John wants to weigh in, but we haven't heard from Paul Stebbins yet. I want to get your take. You want to give us your perspective on 600 to 700 billion as a business guy? Does that sound right?
As a business guy, you know, I'm an entrepreneur. I'm a business builder. So my journey to this table is a little bit different. I don't profess to be a world's expert in healthcare. But I keep thinking as I hear all these, my esteemed colleagues here, of Bertrand Russell. You know, we think in concept and live in the detail. And I think that as a business guy, that's the world that I came from. And I credit Maya and Dave Cody for bringing me to this Fix the Debt initiative, because the reality is the math is very sobering. And when you start thinking at the concept level that health, you know, that 40% historically of GDP was our debt to GDP ratio, we're now at 73, we'll be at 100 in no time. That's pretty sobering. That reality begins to hit. If you go deeper into the drivers and you look at healthcare and you say that, geez, it was 10% of the budget back in 1981 and now it's 20% and it's going to be 30%, that's very sobering. But I would say that some of what we heard this morning resonates with me. I mean, the woman mentioned Spokane. I mean, I worked on a farm in Spokane. I worked in a mine in Medellin Falls, north of Spokane. I know where Spokane is. And there is a reality. Erskine said yesterday on a phone call I was on that Hubert Humphrey used to say that Washington is the 26 square miles surrounded by reality. And I think that as a business guy, I used to have that view. I think many of us were just busy running around the world on airplanes and we're building jobs and creating value. But I would say we were also detached. We were AWOL. We were not part of this debate. And when you come to Washington, I think you get a much deeper appreciation of what Maya said, how hard this is. And it is about primary campaigns, and it is about advocacy that's very powerful, and it is about yelling so loud that you don't get the conversation. So I think that ultimately, as a business guy, I see this as it's not about partisanship, it's about citizenship. So you come here as a citizen wanting to elevate this conversation. And, you know, it's not about advocacy, it's about governance. And I think that we have a higher duty of care in the business community to say you can't just sit outside the 26 miles and yell. You got to have a seat at the table. And I'm with Dave. You know, from my perspective, put it all on the table, whether it's changing the age, whether it's doing the means testing, whether it's the CPI. But in a very real way, I have employees whose productivity is impacted by this every single day. And I have to be alert to that. And they are scared and they're uncertain. And what you hear this morning is fear. And they don't trust me. I'm that corporate guy. I'm that 2%. I'm the dude who's going to ruin it all and take away their life. You know, we have to hear that and build that conversation to a different level. So I think it is a different debate than we've ever had in this country. It's not just more advocacy. It's about a deeper sense of citizenship, and I think we need to remember that. So.
We got about 21 minutes now. I'd really like to open it up, let you all weigh in, chime in. We haven't heard from Maya as well. I'm going to encourage you to participate as well. But Ed, you want to step in first?
Well, if I could, yeah. One of the things we haven't really talked about as much, we sort of skirted around the edges, is the impact of PPACO on all of this. Because, you know, if you think about it, I mean, here's the situation. They're at least going to be taking a run at implementing this, okay, over the next couple of years. And what has not been discussed is, frankly, how incompetent the legislation is and all the ripple effects. So let me just give you an illustration. Say you now want to raise the retirement age as a way to address Social Security and Medicare. Well, now we will have a compounding effect because that means more older people in that wedge who would have retired and been on Medicare now won't retire and be on Medicare, and they'll qualify for the exchange subsidies. Well, what does that do? Well, that takes money out of the exchange subsidies, drives up those costs. But remember, the insurance now, we've artificially compressed the rates. So they're actually getting the insurance pre-subsidy at a rate that's 10 to 15% below actuarial value. And the person who's 20 years old is getting it at 30, 40% above actuarial value. So now you start to shift the subsidy design where more of the money is going to those folks, less to the folks who are the uninsured at low income. The whole thing has a ripple effect throughout the system. That's why that needs to be on the table.
You got some instant reaction right here from here. I can feel her.
Let me just say, on raising the Medicare age, I actually think that we should look at that from a competitiveness perspective, because raising the Medicare age is actually going to, and I'll address the Affordable Care Act, but is actually going to increase costs to employers, right? Because who's going to take up those folks, 66 and 67, who, amongst the population that employers cover, are very expensive? So those, according to every estimate, employers will be forced to take them up. And actually, in raising the Medicare age increases national health expenditures because Medicare per beneficiary is cheaper than private insurance. And so when employers cover it, you're covering a more expensive population, and you are actually driving the costs up for Medicare because those lower cost seniors are taken out of the pool. In terms of the Affordable Care Act, you're absolutely right that the goal of the Affordable Care Act was to cover people. So it is the case that if you raise the Medicare age, and make 66-year-olds and 67-year-olds ineligible for Medicare and then drive it to Medicaid and employers, the Affordable Care Act will take up those other folks. And so it is simply a cost shift because the premise of the Affordable Care Act was to cover more Americans. And that's not a problem, that is a solution. And I would say for all the criticism of the Affordable Care Act, I agree with Mark, we do not know all the causes of lower inflation. But this lowered inflation is a positive, it is one of the best pieces of news in healthcare in a long time. And I believe that the Affordable Care Act and accountable care organizations and bundling and all these issues, which I'm happy to explain what they are ways in which we can change that cost structure and are creating downward pressure on inflation. And I say, again, before we make major decisions, I agree with Mark, before we make major decisions about how to reshape these programs for decades to come, we should know if CBO's estimates of those lines are actually true. Those estimates have been wrong before. If these numbers on inflation hold, they will be wrong again.
Anyone want to weigh in that either on the raising the eligibility age or the downward pressure argument we heard from Neera and to some extent from Mark? Maybe it's not the right time to go big because we're just not sure exactly what's happening
HAP
out there.
supports $385 billion in Medicaid savings. We can have them. We can have savings.
I'll go to John and then Alice.
On the age, I think we ought to be careful. Most people in America today are collecting a Social Security benefit by the time they're 63. Whether that's something we want or not is a different question, but the reality is that people are making that decision, and so if we do decide to raise the age, we are creating a real gap for them. And I'm not sure that employers, frankly, will respond by keeping everybody on until 67. So it would be a big mistake, not only fiscally, I agree with Neera, but also in terms of human quality of life to delay Medicare way beyond when people are actually leaving the workforce. So I want to say three things here, though. $600 billion is a very aggressive number. We have taken a very close look at almost all of the savings estimates from the bottom up. In other words, where will we actually get scorable savings that CBO will credit? We could not get the 600 without doing violence to the quality of our healthcare system and the needs of vulnerable people.
Can I say one thing in that regard? That it is, if you actually sit down and do the arithmetic, it is difficult to get $600 billion. But I think in the context of entitlement reform, a 10-year budget window is a problem because some of the changes we're making here can have a run rate of that kind of number in the year 2022, and that's okay. So if we don't hit exactly $600 billion in the next 10 years, as long as it looks like we're going to get those savings in the next 10 years, because these things have big effects over long periods of time, then I think that's okay. That's okay.
So I agree with that. I think that it's much more important to look at the long term than it is to add up numbers in the short term. I do want to say, though, that the Medicare cost problem is mostly a problem of very sick people. 5% of beneficiaries in any given year account for half of total spending. So it's really a question of how we're going to manage the care for people who have multiple problems, who are in and out of the hospital, who are seeing multiple doctors, taking multiple medications. That's not an easy one to get a lot of savings. The one area of hope I would point to is geographic variation. Medicare expenses and healthcare generally cost a lot more in certain parts of the country and a lot less in others. We should be taking a look at the places where the cost is much lower, Minnesota, Oregon. I mean, we can learn a lot just from looking at the variation within the United States.
Alice, I promised I'd go to you. Your thoughts?
Yes. First, I'm not a big fan of raising the age because I think there are better things to do to reduce the rate of growth of costs for all the reasons that have been mentioned about the problems of raising the age. Unfortunately, it's a simple thing, people can grasp it, and the other things we're talking about are harder. But I don't entirely agree with Mark that we don't know what to do about controlling the rate of growth of costs. We know a lot of things to do. And this evidence that Judd was mentioning and others, that about a third of our costs are wasteful, we know where the waste is. We know that there's some very high cost areas of the country. There are high cost providers. There are low cost providers. Ed said accountable care, that's nothing more than Kaiser. Well, that's right, actually. Kaiser has lower costs. And if we can incent capitated plans that are paid on the basis of their outcomes, I think there's pretty good evidence that we can do better. And the problem is that do we want to put those incentives in through the Affordable Care Act's mechanisms, the Payments Advisory Board, or do we want to do it through competition? Now, when Pete Domenici and I made our plan, we said, let's try both. And I don't think, and by both, I mean using the Affordable Care Act, but also generating competition among capitated full-service plans. Now, that's gotten the bad name of premium support, vouchers, can't do that, it's a terrible thing. But you already have a quarter of Medicare patients in Medicare Advantage. If you improved the competitiveness, improved the market structure in Medicare Advantage, you could get many of these benefits without calling it a voucher or premium support, which isn't, I think, a bad way to go. And again, if I go back to Neera's plan, she suggests that. So I'm only saying that to prove it's not a wildly right-wing idea. Competition is something we all believe in, and we need to do it carefully and well.
David Cody? Yeah, it's kind of interesting, and I've run into this in my business career, and it seems like we probably do that in politics also, is that whenever you run into something that's a difficult time where difficult decisions are going to have to be made, everybody runs to what you can't do. And that's the first thing everybody goes to is, well, we can't do this and we can't do that. So you start doing that, it doesn't take too long before you find out you can't do anything, and you just are where you are, and God, I hope everything works out okay. So we need, if the ideas that were talked about don't make sense, I'm certainly not wedded to any of them, but I sure wouldn't mind hearing ideas that go back to being market credible again. Because that's what we're trying to accomplish here, is this has to be something that causes the world to look at it and say, this is a place to invest again. This is the biggest economy in the world, the most fiscally responsible. They get it. And they're able to manage this and recognize what they're dealing with. And those are the ideas that it seems to me that we need to get, because it doesn't take too long before you can corkscrew yourself into the ground about all the stuff you can't do and just keep wringing your hands. So we need the stuff that we can do. And importantly, it seems to me, we need to recognize this issue is going to get addressed. And we can do it now. We can do it thoughtfully. We could do it proactively, the way a great nation does. Or we can wait a few more years, or even shorter, who knows where that's going to go, when markets start to force us to do it. And we all of a sudden find that for 30-year money, we're paying 5%. And we find ourselves with $1 trillion annual interest bill. And people say, well, that's a Wall Street problem. And you go, well, no, not really, because now your home mortgage is 7 or 8%, your car loan is 10 or 11%. Now you have a Main Street problem, and there's no more money to borrow to buy time. You're done. And when we get to that time, all these changes that we're talking about now will look like, God, why didn't we do that back then? Because compared to what we have to do now, that would have been a lot less draconian. So I wouldn't mind seeing a lot more discussion about, okay, so what can we do that does get us to that $4 trillion plan and does generate big entitlement savings? Because that's going to be a fundamental part of this solution.
I saw Governor Bredesen first, and we'll move back over to this side.
Well, in that spirit, David, I'd just like to echo something that Cindy said, which is I think you'd find that governors could be a huge ally in making this happen. They run the Medicaid program day in and day out. Even in Medicare, the dual eligibles, those who qualify for both, are a huge piece of the expense, and governors have got a lot of tools to deal with that. back when the Affordable Care Act was being negotiated and discussed, the National Governors Association had a committee to try to work with the Congress about how to structure it. I was the Democratic co-chair of that, and the governor of Vermont was the Republican co-chair. Two lessons we learned pretty quickly. First of all, which was that nobody in the Congress cared what the governors thought, so we just weren't part of the political dynamic at the time. But probably more pertinent to that, it was astonishing how little the senators that hadn't been governor and the staffs knew just about the way states worked, about the way these programs actually work in reality. And there are a lot of things in Medicaid that governors could do and have a huge incentive to do because they're paying certainly a significant part of the cost, and it should get costs down immediately.
Can I interrupt you and ask you about the block grant idea?
Yeah, I mean, I happen to think the block grant by itself is a fool's game because over the 8 years that I was governor, I don't know how many times the Congress proposed to do something or other that cut funds to the states, but we're going to give you more flexibility in the way you spend them, and it never works. I mean, it just never works that way, that whatever they do at the beginning, the regulations and so on that come out over a period of time remove that flexibility. So for somebody to give you a block grant which is going up at, for example, the rate of GDP increase or CPI or something, and then tell you you have to do something that nobody else has been able to do in America in terms of containing the costs over the long term with that, I just think puts states in a very difficult position. But, you know, to give you a trivial example, Medicaid has optional benefits. Pharmacy is an optional benefit. If you, however, say you're going to offer pharmacy, you buy the whole package, and that everything is, I mean, everything that you possibly can do or the government says you have to do is part of it. Just say, if you say if it's optional, fine. We'll let you do a little picking and choosing among these optional things and put some things together. Would have an enormous impact on the costs of some of these kinds of programs. Nursing home is also an optional benefit, and so it's a very expensive and very rapidly growing benefit. And I know from experience, we are deeply constrained about doing very reasonable kinds of things. In the pharmacy field, I mean, we in Tennessee tried to do some things that corporations are doing all over the place. I mean, nothing unusual, nothing hurt the quality of care. You can't get them done under the set of rules that have been adopted for these kinds of things. But simple things like that could produce short-term savings while we work on these enormously important long-term changes to the trajectory of the costs in the system.
Michael Peterson?
Yeah, I just want to add to that trajectory and support what Mark said earlier. We spend so much time focusing on this 10-year window and $300 billion, $600 billion, and what's most important is that we solve this problem for the long term. And the goal is to stop the bleeding, not slow the bleeding. And just to put that number in perspective, in the last year of the 10-year window, we're going to spend $1.7 trillion annually on healthcare. So we're going to kill ourselves in the next few weeks. We're going to jeopardize the economy. We're going to jeopardize our credit rating, et cetera, over what we're going to spend in 3 months at the end of that period. So I think what we need to be more focused on is get through this fiscal cliff, get a deal done, and lay the foundation for long-term fiscal reform, which is focused primarily on healthcare.
Senator Gregg, let me get you to weigh in on this because process is part of this, unfortunately. And CBO, this 10-year window, that's a requirement. Congress has to score these things to be able to have an adequate roadmap, if you will, something that both sides can look to. Do we have to change the rules here before we even play the game?
Well, that's always the debate. And as I was listening to the governor and some of these other comments, I was thinking to myself, all these extraordinary practical ideas cannot possibly survive in the context of the CBO scoring structure.
Yeah.
And so that's a forcing mechanism. And secondly, it is this issue of people grab onto the thing that's most easily understood, whether it's changing the age or something else, change CPI, that people easily can explain, understand, and then you create great advocacy around it, both pro and con, instead of doing the more complex and difficult things that actually would get you where you want to go. So I would be interested in Alice's views. I've always opposed directed scoring. I think it's, the strike zone's there, we live with it.
Opposed what? I didn't hear that.
Directed scoring, where the Congress comes in and basically changes CBO. I still oppose it. But I do think somehow And I think it gets to the governor's point, which is that the Congress ignores governors. The Congress ignores a lot of stuff that makes sense because it gets wrapped up in its own nomenclature and its day-to-day activity. I honestly think the only way you break out of this is if you get a White House and leadership in Congress that are willing to take the unusual steps of reaching an agreement that is outside the traditional box. That's where it comes down to, because the Congress isn't capable of doing it institutionally, and CBO limits its capacity to do it. So I hate to say this, but I believe it comes down to the presidency and the people who are charged, like the chairman of the Finance Committee, the chairman of the Ways and Means Committee, the Speaker of the House, and the majority and the minority leaders in the Senate to actually sit in the room and do these types of things that are really extraordinary in the concept of how you make progress on these big issues.
And your level of confidence right now, given where we are, even in the last 24 hours in terms of the offers being out there, that's feasible right now? The look tells me everything.
I think it is feasible. I mean, when you get action from leadership is because A, they want to lead and govern, and B, it's in their political advantage to do the same thing. And I think, ironically, we're in one of these unique windows in America, which comes every 4 years, when governance can take a priority over politics, because everybody, if American politics is a game of political chairs, of musical chairs, everybody's sat down now. You know, some people didn't get a chair, like Mitt Romney, but everybody's pretty much sat down. They know their portfolio of power, and they're going to retain it for the next 5 to 6 months, and then we're back in politics as the first level. So there is a unique opportunity to govern. And secondly, there's a forcing mechanism, which is the fiscal cliff, which is an opportunity to govern. So I honestly think that, although it doesn't appear that way right now, that we will see something happen here that's going to be positive and significant. But this $600 billion number, that's the key number. I mean, that's, you know, I mean, the revenue side is not hard. That's the key number. How do you get to that number?
Do you agree that's the right number? 600 billion?
Wasn't it the number they had 2 summers ago, in 2011?
What, I don't think so. I don't think there were 600 billion. You mean the White House?
Yeah.
We have about a minute left here. Alice Rivlin wants to weigh in. Anyone else wants to make a final thought?
I would disagree with Judd Gregg about the CBO, but I don't think we need to argue about that right now. For all the reasons we've talked about, the outcomes of these experiments are uncertain, and CBO can't buy in before it knows there's evidence. But I'd strongly support what he said about leadership. This is the moment with a huge opportunity for the president to lead and for the Congress, the leaders of Congress and the president to sit down and work this thing out, because it isn't that hard. We can do it. Other countries do it. We can do it. And I see no reason why we should miss this huge opportunity to stabilize our debt, and in the process over the next few months to reform the healthcare system gradually and our tax code as well.
Peter, can I just say one quick thing to just
You got
organize
10 seconds.
David
No, you got
and Mark, which is that I think in these budget negotiations we can do 10-year scorable savings and proposals for the long term. CAP has done $385 billion in scorable savings. So is John in other ways, but I think we should also take the steps, look at this as an opportunity to take additional steps for long-term transformation as well.
I'd like to thank all of our panelists for their ideas and perspectives. Appreciate it, and we'll have more to talk about taxes coming up. We've got a quick break, and then we'll be coming right back after that. Maya will continue the program at that point. Again, we'll be shifting to taxes.